Welcome back. This is Dr. Simon-Cereijido again. This is the second video on risk factors for early communication disorders. Let's go over some additional biological risk factors that may affect a baby's development. We will start now with a prenatal illness that may affect the baby. Cytomegalovirus or CMV. CMV is the most common congenital viral infection in the United States. Congenital means that it is present at birth. Each year, about 1 in 750 children in this country are born with CMV and have or develop disabilities resulting from congenital CMV infection. More children have long-term medical conditions due to this disease than other well-known congenital infections and syndromes, including Down syndrome, fetal alcohol syndrome, spina bifida, or pediatric HIV/AIDS. Babies with congenital CMV infection may develop hearing or vision loss, intellectual disability, liver problems, or growth problems. About half of infants with symptoms of congenital CMV infection will develop permanent health problems within the first few years of life. Sometimes, problems such as hearing or vision loss do not occur until months or years after birth. 10 to 15% of infected infants who show no symptoms at birth develop health problems later on, most commonly hearing loss. The good news is that with proper care, most infants with CMV disease survive. CMV is spread from person to person by close contact with body fluids such as blood, urine, saliva, semen, vaginal fluids, and breast milk. Once CMV is in a person's body, it stays there for life. Most people who become infected with CMV have mild flu-like symptoms or no symptoms at all. The exceptions are infants with congenital infection or people who have weakened immune systems. For pregnant women, sexual contact is a common source of CMV infection. Limiting sexual partners and practicing safe sex may reduce the risk of catching CMV. Another common source of infection for pregnant women is contact with the urine or saliva of young children who are infected with CMV and are shedding the virus. When a virus is shedding, it is moving from the body of an infected person into the environment. This is why the strategies you see on this slide are so important to prevent infections. Viral illnesses like rubella during the first trimester can result in a range of problems including deafness, heart problems, cleft palate, and intellectual disability. Let's move now to illegal substances. Exposure to illegal substances also increases the risk for developmental delays. When a pregnant woman is exposed to these drugs, the chemicals easily cross the placenta that is passed between the mother and fetus because of their low molecular weight. In the fetus, the drug concentration is typically 50 to 100% the concentration of the maternal level. For all substances, prevalence rates are highest in the first trimester. Lower rates of exposure in the second and third trimesters are encouraging and suggest that pregnant women are responding to education and other interventions to reduce prenatal substance use. However, the data also highlight the need to strengthen efforts to identify and reach women before they get pregnant, as well as in early pregnancy when substance exposure can have a significant consequence for the developing fetus. Substance use rates among pregnant women also vary by age groups, with both past months illicit drug and alcohol use highest among teenagers. It is difficult to estimate the actual prevalence or incidence of illegal substance exposures as its use is illegal. It is also known that these drugs are frequently mixed with over-the-counter drugs, which are currently becoming a serious public health issue in our country. The timing of the exposure to illegal drugs is important for pregnant women and their babies. Most body organs and face and head structures are developed during the first trimester. So, exposure to these toxins during the first semester may put the baby at risk for communication disorders. Recent research has found associations between cocaine exposure and depressed language in children from 3 to 7 years of age. Children who have been prenatally exposed to cocaine appear to be at increased risk for deficits in expressive language also compared to non-exposed children from similar socioeconomic backgrounds. Greater severity of prenatal cocaine exposure, as measured by mother self-report and drug testing, was found to be independently associated with greater deficits in language performance. This suggests that the developmental consequences of prenatal exposure to cocaine may be influenced by the severity of the exposure. Other substances such as alcohol, tobacco, marijuana also have been found to have an effect on language development. Prenatal exposure to tobacco and marijuana has been found to predict deficits in language. There are some commonly used teratogens and legal that are also related to premature birth and developmental delays. For example, tobacco use by pregnant women has been related to premature birth and associated low birth weight, miscarriages, decreased placental blood flow, and subtle developmental delays. Take a look at this illustration from the U.S. Department of Health and Human Services. Look for the health consequences of smoking and of secondhand or environmental tobacco smoke exposure. You can see that tobacco exposure has adverse effects on body systems that support hearing, speech, and language. So here, respiratory, same here. Pneumonia, okay? Let's move to maternal use of alcohol. Drinking alcoholic beverages is not recommended for pregnant women. Heavy alcohol use can result in fetal alcohol syndrome. Over 40% of women who drink heavily have children with FAS, or fetal alcohol syndrome. Lower levels of alcohol intake during pregnancy can also lead to fetal alcohol effects, reflected in significant developmental delays. There's actually no safe level of alcohol intake in pregnancy, at least it has not been determined. FAS is characterized by a pattern of malformations and disabilities resulting from heavy or binge drinking during pregnancy. It causes brain damage and growth problems. The problems vary from child to child, but defects caused by fetal alcohol syndrome are irreversible. Physical defects may include distinctive facial features, such as a wide-set eyes, an exceptionally thin upper lip, a smooth skin surface between the nose and the upper lip. Other problems may include deformities of joints, limbs, and fingers, slow physical growth before and after birth, vision difficulties or hearing problems, small head circumference and brain size, and heart defects and problems with kidneys and bones. Another exposure is the exposure related to caffeine. Caffeine is another common teratogen. It is a stimulant to the central nervous system. There is no evidence linking low to moderate caffeine use and poor developmental outcomes. But consumption of more than 300 milligrams of caffeine on a daily basis has been associated with an increased risk for miscarriage and fetal death. The risk is higher if caffeine consumption is combined with alcohol and smoking. So more than 300 milligrams is dangerous, and above you can see what a typical cup of coffee or kind of cola has in terms of caffeine. Okay, so we talked about illnesses and exposures. We stop here our second lecture, write down questions, take notes, and we will continue in the following presentation. Thanks so much.